What brought me to PCI is I had a routine blood test. It's called a PSA count, and it was elevated. And so then my local doctor suggested or recommended I get in to see a urologist.
PSA is a blood test. Simple blood test. You don't need to be fasting. It stands for prostate-specific antigen. It is an indicator of potential problems in the prostate. Often you have to watch it over time and kind of see what's going on. And it's the interpretation of that, I think, that is the unique part for each personal patient. Typically, if PSA really presents a problem or the digital rectal examination is abnormal, the next step in the process would be a biopsy of the prostate. By and large, we'll do that as a procedure here in the office.
Dr. Rippentrop gave me the option when I was to have my biopsy, whether to do it here in the office or at the hospital. I chose to do it in the office because otherwise it would involve the anesthesiologist. So I chose to just come to the office, and that was a good choice.
I think it's important for them to know that no matter what they choose, that you're going to be with them on the journey, you know, and make sure that things are going to go okay long term, and that, you know, we'll preach at them about something and make them laugh about something else.
What sets Dr. Rippentrop apart, I mean, he's the only urologist I've actually had to visit, but I really like him. He's sharp, he's young. It's like I think this younger generation has more of a sense of humor. I like his approach to interaction with the patients.
Prostate cancer in general doesn't give you symptoms. You can't wait for symptoms of prostate cancer. By the time you have symptoms, you can't be treated. That's why early detection makes a difference. PSA is one way to do that. The American Urologic Association currently suggests your first PSA at 40 and then base rechecks on that level at 40. Realistically, if you can get one at 50, that's better than nothing.
Better to catch it when it's early in the stage before it gets, you know, too far along, because then all I can do is control it.
Just because it is elevated doesn't necessarily mean that you have prostate cancer, but just because it's normal doesn't mean you don't. It is not a perfect indicator for prostate cancer, but it is an indicator of potential trouble. And it's important to follow that and the trend of that over time to decide whether or not somebody has the concern for prostate cancer or not. But if you don't get the test, you don't have the information.
My experience coming to PCI is positive. The secretaries at Dr. Rippentrop's office, to the guy that helps me with the car when I get, when I get here, it's a class act.